Hey everyone, I'm Dr. Jomaa, the sports med specialist, and welcome back to my Brazilian Jiu-Jitsu Injury Series. In this series, we help you understand the injuries that commonly occur in BJJ and grappling sports, and most importantly, how to prevent and manage them. In this week's video, we're focusing in on shoulder injuries. Shoulders are the third most common injured area in BJJ after knees and elbows, which we'll actually be covering next time. During today's video, we're going to cover the 5 most common shoulder injury presentations in BJJ and grappling sports. We're going to review how they occur, what symptoms to watch out for, and how they're managed. If you're looking for a specific injury, then you can jump straight to it following the timestamps below. If you think this is the sort of content that will be useful, please hit the subscribe button as there's plenty more on its way. And if you know anyone that might benefit from this content, please do share it and help the channel grow. Finally, please remember that this is all educational, informational, and entertainment content. It's definitely not medical advice. If you have your own injuries, please make sure to see a healthcare professional. Okay, so let's start by laying down the foundation and talking about 3 key anatomical principles that you need to understand if you're going to get your head around the shoulder joint. So anatomy principle number 1, the shoulder is inherently unstable. The shoulder is actually the most mobile joint in the body, and as a general rule, mobility and stability of a joint are trade-offs of one another. Whilst it's described as a ball and socket joint, the shoulder anatomically actually looks more like a golf ball resting on a tee, and functionally acts more like a beach ball balancing on the nose of a seal, often rolling just off the edge of its lip to maximize its range. All of this mobility makes it an incredible attacking tool in the grappling arts, but also a vulnerable area to have to defend. Shoulder lock submissions like Kimuras and Americanas look to attack this weakness. Anatomical principle number 2. The shoulder joint isn't actually attached to the rest of your skeleton. Well, it is, but only at the acromioclavicular joint. So this is this tiny little joint here, which is only about 1 centimeter squared in surface area. This joint is by no means designed to carry any real load at all. In fact, when it is forced to carry load, which is usually due to a dysfunction elsewhere, then it quickly becomes overloaded and a key injury area, which we'll go on to explain. And finally, anatomical principle number 3. Over a third of our shoulder's range of motion doesn't actually come from the shoulder joint itself, but it comes from the movement of our scapula or shoulder blade on our rib cage. In essence, a third of your shoulder's range of motion and a huge part of its mobility and stability actually come from your back. Very often, issues in the shoulder are not due to shoulder problems per se. In these instances, the shoulder is more of a victim of weakness in the back rather than the problem itself. Great, so we've now set some foundations. Let's outline the 5 most common injuries that we see in shoulders during grappling sports. These are, number 1, shoulder dislocations and subluxations. Number 2, rotator cuff tears and tendinopathy. Number 3, labral tears. Number 4, acromioclavicular joint injuries. And number 5, overuse injuries like impingement and bursitis. So let's break down each one of these injuries so that you can know what to look for and how to avoid them. So first of all, shoulder dislocations and subluxations. Dislocations occur when the head of the humerus pops out from the shoulder socket. But most commonly, it's seen as a result of submission attempts like Kimuras, Americanas, and omoplatas. So an Americana position forces the shoulder into extreme external rotation, making the shoulder pop out of the front here, and a Kimura is the opposite. It's forced into internal rotation until it pops out the front. Subluxations are partial dislocations where the shoulder slides out of the lip, but then usually slips straight back in again. So what symptoms do you expect? Well, shoulder dislocations are quite hard to miss. If it's the first shoulder dislocation, it's going to come with an intense amount of pain, and the shoulder will look visibly out of place with a loss of range of motion. If it's something that happens quite commonly, usually it's quite painless, and often the shoulder, depending on how many times it's come out before, can just slip back in. Shoulder dislocations can also damage the axillary nerve, which wraps around the neck of the humerus, and this causes a lack of sensation on the lateral part of the shoulder just here. Shoulder dislocations require immediate reduction, and this should ideally be performed by a trained professional who makes sure to check the nerve function and the blood supply before and after a procedure. In reality, when the shoulder's popped out many times before and it's quite sloppy, then it usually slips back in itself and it can be popped back in by the patient or their teammate. If it's a first dislocation, it's crucial to get imaging, and this includes an X-ray and MRIs, and these check for fractures and labral damage. The pattern of injury that we see on an MRI help doctors calculate the risk of re-injury and the possibility of managing the shoulder injury with or without surgery. Rehabilitation is always essential, and this focuses on strengthening the rotator cuff and scapular stabilizing muscles to prevent recurrence. So let's talk now about the rotator cuff. The rotator cuff is a group of muscles and their tendons that come from the shoulder blade and wrap around the head of the humerus in order to stabilize the joint. Given how inherently structurally unstable the shoulder joint is, these tendons are the most important factor in keeping the shoulder stable and sound, and a strong cuff massively compensates for a structurally unstable shoulder. In BJJ, these structures are at risk of acute injury and relative overload. Acute injuries occur from a fall on an outstretched hand or looking to resist a submission, whereas overuse injuries are usually a consequence of overtraining. Mild cases respond well to rest, physical therapy, and strengthening. Moderate tears respond well to orthobiologic injections like PRP, and the more severe tears might require surgical repair. So let's talk about the labrum and labral tears. Now, the labrum is a ring of cartilage which wraps around the socket of the shoulder joint, and it closely resembles a ring of calamari. This structure is really important functionally. It deepens the shoulder socket, creates a negative pressure suction effect to keep the shoulder feeling more stable. The labrum can be torn during high force events like arm drags, being stacked, or a sudden pulling motion. And of course, it can be torn during dislocations where the head of the humerus will rub against the bottom lip. Typical symptoms are a feeling of instability, clicking, catching, and locking up of the shoulder, especially pain with overhead movements and throwing movements. By and large, conservative management, including physical therapy and strengthening exercises, is recommended. If there are larger tears and unstable tears, they might require surgery, but the evidence base is tending away from this, showing that the medium to long-term outcomes are quite similar between rehabilitation alone or surgical repair. Next, let's talk about the acromioclavicular joint, which can be injured from direct impact, like falling onto the point of a shoulder, which might happen during a takedown. And it can also be overloaded when the arm is forced across the body. And you can imagine that happens quite often in triangle submissions. The symptoms are pain at the top of the shoulder, swelling, and a visible bump or deformity in more severe cases. Recovery is fairly optimistic. Lower grade acromioclavicular joint injuries can heal with rest, strengthening exercises, particularly those that target the back and the scapula, and they look to open up the chest to take the load off the joint. Remember the anatomical principle that this joint is not designed to carry load. In severe cases, they may require a surgical repair. Finally, we'll talk about impingement and bursitis. Impingement most commonly occurs in the subacromial space, where the tendons and the bursa get pinched during overhead arm movements. The main movement is reaching into the cookie jar, so you have your arm across your body and then you turn inwards, and that causes pinching. In the short term, a cortisone injection into the bursa might settle down the pain and swelling and can help facilitate training or participation in a competition. In summary, shoulder injuries are very common in Brazilian Jiu-Jitsu due to the dynamic nature of the sport. Prevention is always better than cure, and so here are my top 5 shoulder injury prevention tips. Number 1, warm up thoroughly and focus specifically on dynamic stretches that activate the shoulder and surrounding muscles. Number 2, strengthen the stabilizing muscles, and in particular the scapula. Number 3, practice proper technique and avoid bad habits like muscling in submissions or forcing positions. Number 4, listen to your body. Pain is a warning sign, especially when it comes to the shoulders. Do not train through it. And number 5, tap early and tap often. It's always better to reset than risking a long-term injury. A shoulder dislocation could have you out for 6 months or more. Thank you so much for watching this video. I really hope you found it helpful. If you do like what you're seeing, please make sure to like and subscribe to the channel. There are plenty more injury insights on their way in the coming videos. Please let me know in the comments if you have any questions or you want any more videos diving into the topics mentioned here. Next time, we'll look at the next most commonly injured area in the body, which is the elbow, and I look forward to seeing you then.